Hi, my name is sarmi. I'm a BSN student at Indiana State University. I'm here to present a topic called HPV vaccination. HPV is human papilloma virus. So I'm talking about HPV vaccination to prevent human papilloma virus infection. So we all take our children to get their regular vaccination, DPT, Tdap. We all aware of that. So how well we are aware of, or you are aware of about HPV vaccination? I'm just going to talk a little bit about HPV vaccination. What do you know about HPV or human papilloma virus? Before we get to know about the vaccination, we should get to know what is HPV virus. What is HPV virus? How dangerous it is. So some questions before we talk about that. What is HPV? What diseases are caused by HPV? How do people get HPV infection? Who is at risk? Who needs HPV vaccination? How many shots does my child need? Why is HPV vaccine recommended at the age of 11 or 12 years? What are the side effects? How long does the protection last? How safe is the HPV vaccine? Is HPV vaccine covered by insurance plans? These are some questions I'm going to talk about. What is HPV? Like I said, it's a virus. It commonly causes genital warts, but some of the virus groups can lead to cancer in both men and women. So that's why it's very important and dangerous. HPV is a group of more than 150 related viruses causes papilloma warts, and some types can lead to cancer in both men and women. Diseases caused by HPV. HPV infection causes cancer of mouth, throat, and anus of rectum, both men and women. HPV infection can cause cervical, vaginal, and vulvar HPV cancers in women. Men can also get penile HPV cancer. Cancer cells. This is just a picture of a commonly occurring cancer in women called cervical cancer. This is caused by HPV infection. So just to show you how dangerous it is, how does it look like, how ugly it is. So we can prevent this cancer or this infection by vaccination, HPV vaccination. How do people get HPV? HPV is transmitted through intimate skin-to-skin contact. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread through vaginal or anal sex. Who is at risk? Anyone who has ever had genital contact with another person may have HPV. Both men and women may get it and pass it on without knowing it. Since there might not be any signs, a person may have HPV even if years have passed since he or she had sex. So this virus can be silent in your body. It never shows any symptoms. So you can carry this virus forever without showing any symptoms. You are most likely to get HPV if you have sex at any early age, many sex partners, or a sex partner who has had many partners. How can you prevent this? A good news is vaccination is available. A vaccine is available to prevent the human papilloma virus types that cause most cervical cancers, as well as some cancers of anus, vulva, vagina, and oropharynx. Vulva is area around the opening of the vagina, and oropharynx is back of the throat, including base of tongue and tonsils. So this vaccine is available to prevent these kind of cancers. This vaccine also prevents HPV types that cause most genital warts. Who needs HPV vaccination? All girls and boys who are 11 or 12 years old should get the recommended series of HPV vaccine. HPV vaccine is recommended for young women through age of 26 and young men through the age of 21. Young men who have sex with men, including young men who identify as gay or bisexual or who intend to have sex with the men through the age of 26. Young adults who are transgender through the age of 26. Young adults with certain immunocompromising conditions, including HIV, through the age of 26. How many shots does my child need? 2 doses for children starting the series before their 15th birthday. The second dose of HPV vaccine should be given 6 to 12 months after the first dose. So if your child is starting 9 to 15 years, the first shot, if you're starting before 15th birthday, you need only 2 doses, 6 to 12 months apart of between the doses. But if you pass the age, if you pass the 15th birthday, you have to get three doses of vaccination. Teens and young adults who start the series at the age 15 through 26 years still need 3 doses of HPV vaccine. Also, 3 doses are still recommended for people with certain immunocompromising conditions aged 9 through 26. So 15 to 26 years and immunocompromised need 3 shots, still 6 to 12 months apart. HPV vaccine recommended at the age of 11 and 12 years. Why? You may have this question in your mind, why my child is my children or my child is very young, they are only 11 or 12 years, they're not sexually active, why should I take the children to get the vaccination? To be effective, the series should be given prior to the exposure, that means before the beginning of any sexual activity. That is recommended by CDC. How long does such protection last? Protection is long lasting. Current studies have followed vaccinated individuals for 10 years and show that there is no evidence of weakened protection over time. So it is long lasting. Side effects. Many people who get HPV vaccine have no side effects at all. Some people report having very mild side effects like a sore arm from the shot. We all get that soreness from any shots. The most common side effects are usually mild. Pain, redness or swelling in the arm where the shot was given, fever, headache or feeling tired, nausea, muscle or joint pain. These are very mild side effects you may get from this vaccination. Is HPV vaccine covered by insurance plan? Yes. Health insurance plans cover the cost of HPV vaccination because it is recommended by CDC. CDC is Center for Disease Control and Prevention. If uninsured, there is a program called a VFC, Vaccine for Children. Those are available through federally qualified health centers or rural health centers. If you are uninsured, these are free. How safe is the vaccine, is HPV vaccine? The HPV vaccine has been licensed by FDA, Food and Drug Administration. The Center for Disease Control, CDC, has approved this vaccine as safe and effective. Some questions, I already gave you a post-test. Just go over it and just try to fill the answers. If you have any question, feel free to ask me. And how well you know about HPV now? And please complete the post-test questions. And thank you for your time.